Marijuana is now becoming a major business here in Oklahoma. Last week, we showed you just how many dispensaries have popped up here.
And all new this morning, we take a look at the patient side. 2 Works View's Giselle Puente talked to local doctors about the most common health conditions people have in order to get a license.
Cannabis has been my answer to all my prayers.
Medical marijuana had never crossed Dawn Arbel's mind until it became legal in Oklahoma. Before the drug, she says her quality of life started to suffer from previous medications.
I was on every triptan possible for migraines, and those adverse effects were horrible. I couldn't function. I had to be at home, in bed, asleep.
Arbel says she's had carpal tunnel syndrome for the past 8 years, causing her pain in her wrists. But that's changed.
Well, this one is, it's a pain roll-on. You just roll it on, and it has the CBD in it.
Arbel is one of more than 89,000 people who have been licensed by the state to use medical marijuana, and that number is only getting higher. The Oklahoma Medical Marijuana Authority receives about 5,000 patient applications a week. This demand keeps doctors busy.
We see a lot of people, but we're very thorough. Everything gets put into the medical record.
Dr. Meredith Woodward, who is certified by the Board of Neurological Surgery, is one of the local doctors who currently recommends patients for medical cannabis.
I would say the majority of people are middle age to old age.
She says the most common health conditions she sees are anxiety and depression. It's up to her to consider what is deemed necessary to make a recommendation. Unlike other states, such as Arizona and Colorado, patients must meet certain qualifying conditions to access medical cannabis, which include cancer, glaucoma, HIV, and PTSD. While Oklahoma has one of the least restrictive laws in the country, Dr. Woodward doesn't see this as a bad thing.
We get people randomly who have a condition that I would never have thought of that cannabis might help. And what if that weren't on the list?
On the patient side, Arbel says not everyone might benefit from medical marijuana, but it worked for her.
I get out, I walk around, I hike.
Reporting in Tulsa, Giselle Puente, 2 Works for You.
Now, of course, marijuana is still considered a Schedule I drug and remains illegal under federal law. The Office of National Drug Control Policy says marijuana use can have adverse health effects and has a high abuse potential.